Imagine a 55-year-old man arrives with severe crushing chest pain radiating to his left arm. An artery supplying his heart is completely blocked by a blood clot. As soon as blood flow stops, the heart muscle is deprived of oxygen. Remember one golden line: time is muscle. Every passing minute means more heart muscle dies, changing reversible ischemia into irreversible necrosis. So, how do we know this is a STEMI? Look at the ECG. There's street segment elevation in leads 2, 3, and AVF, with reciprocal ST depression in AVL. This pattern tells us it's an inferior wall STEMI. Once STEMI is diagnosed, don't waste time. The next decision is all about restoring blood flow as quickly as possible. The best way to reopen the blocked artery is primary PCI. A balloon compresses the clot, a stent keeps the artery open, and blood flow returns immediately. That's why primary PCI is considered the gold standard, giving lower mortality, fewer reinfarctions, and better overall outcomes than thrombolysis. But here's the question every NEET PG exam loves to ask. Can the patient reach a PCI-capable hospital within 120 minutes? If the answer is yes, go for primary PCI. If the answer is no, don't wait. Waiting means losing more myocardium. If PCI will take more than 120 minutes, and the patient presents within 12 hours of symptom onset, give immediate thrombolysis. Drugs like tenecteplase, alteplase, or streptokinase dissolve the clot and restore blood flow, buying precious time for the heart. But here's a common mistake. Thrombolysis is not the final treatment. After successful thrombolysis, the patient must still be transferred to a PCI-capable center for coronary angiography, followed by PCI if needed. This is called the Pharmaco-invasive strategy. Before giving thrombolysis, always rule out major contraindications. Think of previous intracranial hemorrhage, active internal bleeding, recent ischemic stroke, and suspected aortic dissection. Missing these can turn a life-saving treatment into a life-threatening mistake. Now let's lock this into memory. PCI within 120 minutes? We do primary PCI. PCI delayed beyond 120 minutes, symptoms within 12 hours, and no contraindications. We do immediate thrombolysis, followed by transfer for angiography and possible PCI. That's the entire algorithm. And here's the one line you should remember for your exam. 120 minutes decides the treatment. If you remember this rule, you'll solve almost every NEET PG STEMI Reperfusion question with confidence. Follow Concept RX for more astonishing videos.